y'all for joining us again. Thank y'all for being here today. Before we get started, obviously, the times that we're in has forced us to be here, and a lot has happened this year. But with the election been here, come and gone, that now we are in a new place, but a lot has happened and there's a lot of recap, and it's interesting to see what the path is going to be forward. So I'm going to go ahead and pass it off to Lee to go ahead and kind of ground us and talk about the election and its impact on our work moving forward. Go ahead, Lee.
Yeah, hey everybody, and thank you for being with us this morning. We did want to provide just a little bit of time this morning to give a recap from sort of NC AIDS Action Network's perspective about the election outcomes in North Carolina and what it's going to mean for our work moving forward, particularly with an eye to the General Assembly, of course. I think folks, a lot of y'all are super political as well, but just to level set, I think the best synopsis I heard from someone is that the results in North Carolina really don't change much of anything. Roy Cooper, who has been our Democratic governor for the last 4 years, was reelected, and the rest of the Council of State seats, which are the 9 other statewide elected official offices, really stayed about the same. Josh Stein, Elaine Marshall, and Beth Wood, who are 3 Democratic current incumbents, were all reelected, and the rest of those seats stayed in Republican control. In terms of Cooper, obviously he's important because he did veto a number of bills that we as an organization opposed and worked against last year, and would certainly expect him to maintain some of that. We're also, I think felt that he was able to appoint leadership at the Department of Health and Human Services who was particularly friendly and strong to work with. Secretary Mandy Cohen, of course, has been a real champion and leader for Medicaid expansion in North Carolina. Her office has also done some really important work around harm reduction and around HIV. And so I think we're, hopeful that we'll maintain strong leadership at the Department of Health and Human Services. It is kind of exciting to see her name has been floated in a couple spaces as a potential secretary of the United States Department of Health and Human Services in the Biden administration. She was the chief of staff at Medicaid at CMS under Obama, and so took the job in DHHS when Trump was elected. So it's just, I think, really exciting for our state to have the potential for someone who's been a really strong leader to be elevated to the national level. I think there's actually, candidly, a lot of expectation that no matter what ultimate role, she may return to DC and we may be appointing a new DHHS secretary in the coming months. In terms of the General Assembly, same thing I said last time, everything sort of stayed the same. Democrats picked up 1 seat in the state Senate and they lost 1 seat in the state House. So they maintained veto-proof majority, or their Democrats are able to sustain a governor's veto if legislation is passed that he vetoes. Again, most recent example why that was really important, we worked in coalition with a number of partners to stop a bill that would have put really harmful criminal sanctions in place for women and for people who are pregnant in North Carolina who use drugs. Just felt that bill and the approach really wasn't a harm reduction approach, it wasn't a public health approach, and that bill was vetoed by the governor, and that veto was able to be sustained, and ultimately not overridden because of the Democratic majorities in the House and Senate. So I think many of us had thought Democrats might reclaim a chamber, and that might have given us increased leverage to work on Medicaid expansion next year. Many of you know that has always been a priority for us. It is going to stay a priority for us. Candidly, I think some of us are concerned that the path forward on Medicaid expansion is just still really, really hard. That with everything staying the same, the opportunity may be limited next year than what we thought was going to be the case. But of course, we will continue to champion Medicaid expansion. In 2021, we're going to be especially eyeing some harm reduction work, want to make sure that our syringe law stays strong and that there's no efforts to weaken that law. We will continue to champion appropriate funding for both HIV and hepatitis work within the Division of Public Health and the Communicable Disease Branch. And many of y'all have heard us start to talk about this more over the last 6 months, but are increasingly interested in the role pharmacists play in distributing both pre-exposure prophylaxis and post-exposure prophylaxis, and are looking for either an administrative path or a legislative path to get pharmacists legally able to prescribe post-exposure prophylaxis in North Carolina. So certainly, if folks are interested in delving more into that topic with us, we did host a webinar on that topic that's on our YouTube channel, or either Matt or I have both been doing a lot of work around that and could talk to folks one-on-one offline if you were interested. Any high-level questions or comments or thoughts about the election results and sort of our legislative landscape heading into 2021 before I pass it back? I will note on the Medicaid front, we are also going to be closely monitoring the transition to managed care, to the privatization shift happening next year. That in theory will happen next year. It's been delayed on a number of times. To kick things off yesterday, we did host a Twitter chat from 10 to 11. If folks go back and search hashtag BPAS 2020, we had 3 really excellent folks, including Rose Hoban, who's a pretty prominent health journalist in North Carolina, tweet a lot of really valuable information about Medicaid and why the Medicaid program is so important to folks living with HIV. So feel free to go ahead and check that out if you haven't. That's also your invitation. It's of course looks a little different this year, but do want to stay active on social media. Feel free to post, content, quotes, pictures of the day, and do ask that you use hashtag BPAS 2020 so we can help lift up and elevate and monitor all of that. Thanks so much, everybody, and I'll pass it back to Christina.
Thank you, Lee. Thank you, Lee. A bit of what happened during the election will definitely have an impact on, ETE planning and just our work generally, which actually gives me a bit of hope. I feel like we have so much to talk about this process and how it's been so far and all of that. But before we get started, I do want to make an announcement that normally if we were together, we would have a lot of opportunities to take photos and stuff. So since that's not happening, we would love to take a Zoom group photo after the plenary. But we get that everyone may not want to be on camera, and we didn't warn people. So if you don't want to be on camera, that's fine. But we just wanted to give you a warning that we would love to have a photo to be able to help commemorate the day. So that'll be happening after the plenary. So it's a heads up. But yeah, before we get started, I just kind of want to ground, why we are having this conversation. We actually had something else planned for this, but I thought that this would actually be a good time to talk about this process, because prior to COVID coming in 2020, there had been a lot of efforts going on across the country to help end the HIV epidemic. And obviously for folks who have been in this space for a while, we've been in the work, we've been doing that and been trying to, influence and coerce our legislators and our city officials and folks to be able to create our own plans. And that's been happening across the country for a few years now, whether it be in California and New York, even Jackson, Mississippi. They have their own ending the HIV epidemic plan. And so being in North Carolina, seeing all of that happen, I'm kind of just like, we got to get on that train. We got to do that. And so at the end of 2018, luckily, the state folks were kind of in agreement and wanted to start this process. So they talked to NCAN to help them throughout the process to help ensure that there is community involvement and feedback given from the community to directly inform this process. A little bit after that, in February of 2019, the current president used his State of the Union address to to all of a sudden create his own Ending the HIV Epidemic initiative. And yeah, I feel like on its face, for what it is, you know, like that's a good thing. It's a good thing for the federal government to be prioritizing ending HIV. However, you all have been awake, hopefully, the past 4 years and have seen what we've gone through. So imagine how that process has been, trying to operate in good faith, advocate for our communities, but dealing with an administration who is not operating with the same rules. And, you know, throughout this process, and through this conversation, I do want to be able to hopefully highlight the work that folks like me at NCAN and other folks across the country doing this policy work, asking questions to, you know, federal folks when they come and give us their reports, and asking them the tough questions, what's missing, what's not, and just that tenuous relationship that we've been having. So I hope that this conversation will kind of provide some insight as to what this experience has been like so far, and kind of like let y'all be a fly on the wall a bit about our experience. So I'll introduce our presenters. Joining us to have this conversation is one of my friends, Aisha Davis. She works over at the AIDS Foundation of Chicago. I actually met her before you started working there. We met at a political training in Chicago, and that was quite an experience. I will leave it at that. We definitely, I feel like, almost got hazed together. So I feel like we're bonded in a unique way. And I'm so glad that she is working in this space. You know, Aisha definitely has brought such value to the movement. Anytime she speaks and brings anything to the space, it's always just like, oh, yes. Second, whatever Aisha said, we need to do that. So we are lucky to have her here today and to have her working in the movement. We have another friend, Max Boykin, working with the Black AIDS Institute. Max and I have gone to plenty of lobbying meetings together and have had challenging conversations. And I always love how he always brings the perspective of Black folks into any meeting that we're in, and is always insistent that that's explicitly stated and brought up. And I think that we all need to do more of that. And I'm just grateful that he's here to be able to join us. And then we have a familiar friend, Jeffery Edwards Knight, who's currently on our board, who's a long-term NCAN family member and friend who works at the Mecklenburg County Public Health. And you've been quite involved in the ETE planning process, both on the state level here in North Carolina, but you've been also working on federal efforts in Mecklenburg County. This Mecklenburg County and Charlotte was one of the jurisdictions under the federal plan. So he's been ETE'd out, to say the least. So I thought he would be really good to be able to provide those dueling perspectives. So just to kick off, I just want to pass it off to my panelists and ask them to introduce themselves more formally and talk a little bit about their work and what they do. So I'll go ahead and start with Aisha.
Good morning, everybody. My name is Aisha Davis. Like Christina said, my pronouns are she, her, and hers, and I am the Director of Policy at AIDS Foundation Chicago. At AFC, we are primarily focused on a lot of state and local level efforts. We also do a pretty significant amount of federal work. So some of the work that I've been able to help out with has been around our Getting to Zero plan here in Illinois, which is our state-specific plan, and then also larger, broader federal ETE efforts. So yeah, I think that that's it for an introduction. I'll pass it off.
All right, Max, go ahead.
Good morning, y'all. Max Boykin, he, him, his pronouns. Black AIDS Institute is where I work on the policy and organizing manager here. We have a national reach, and we're a national think tank thinking about how in which we end the HIV epidemics explicitly within the Black community, understanding if we end it within the Black community, we will be working constantly to end it here in this country and across the world. So, and understanding the structural factors that impact and disproportionately impact Black folks, using a critical race theory as a foundation to the work that we continuously do. And thank y'all so very much for inviting me here, and happy always to speak to our folks in North Carolina.
Yes, thanks, Max. Go ahead, Jeffrey.
Well, good Saturday morning, everyone. Jeff Edwards Knight, and as Christina mentioned, I work with Mecklenburg County Public Health here in Charlotte, and I supervise the county's HIV and STD community testing and outreach program. And also, as part of my work, I work with, as Christina also mentioned, with the county's Ending the Epidemic program, with the state Ending the Epidemic program, and also on the federal level. And I'm also the lead person for Mecklenburg County's PrEP initiative.
Jeffrey's got his hands full. But yeah, so as you know, these folks are well qualified to be on this call and to have this conversation. I know I sent y'all some questions ahead of time. I'm gonna go ahead and skip one and just jump to number 3. I know that, like I mentioned earlier, we were talking about how there have been efforts both on the federal level and the state level. So let's focus on the federal level at first. Just to kick us off, if you can think of one word to describe the federal ETE planning process, what would you pick? I'll go first. The word that came to mind is gaslight. Yes, that's my word. Aisha, what's your word?
I will have to say conflicting is the one that came to mind for me when I thought about this question.
What about you, Max?
Lacking.
Lacking. Jeffrey?
Seedling.
Seedling. Interesting choice of words. Yeah, I mean, I asked that because, to be honest, like we were saying, like there's just so much going on. It's hard to exist in a vacuum. Even though I feel like a lot of us who do this work, it's easy to just focus on what we're doing. But when there's literal chaos happening, it's even hard to focus on the meeting at hand because we're looking at Twitter and seeing things unfold. And so, I chose the word gaslight because I felt like, we would have these meetings and, be much like have our agenda, have our federal agency folks who come in and give us their spiel about whatever they're working on. And then, of course, we ask the obvious questions. And then there's tension and all of that. But I want to ask all of y'all, can you share your thoughts on the impact of the current administration's policies surrounding healthcare, LGBTQ folks, and communities of color, and what that has had on the federal ETE planning process? Aisha, go ahead and start.
Sure. Well, one reason why I picked the word conflicting is because we have this person who's sitting in the Oval Office talking about how there is this new push to end the epidemic when addressing the nation, but the policies that follow do not line up with that, right? Like it seems like there's this belief that somehow the epidemic will magically end, even though there are so many efforts happening that counter all of the science, all of the history, all of the information that we have around actually providing care, actually preventing new cases, actually making sure people get the treatment that they need. And so for me, it's like, well, you're talking out of both sides of your mouth right now. And anytime there was any question, like you said, Christina, anytime you have a question and obvious questions, right? Like very simple 101 level questions, you got to get met with a shrug, or you'll hear about something like the attempt to gut Section 1557 of the Affordable Care Act, right? So really an effort to make sure that healthcare providers can discriminate against trans people, especially, but also other LGBTQ folks. That also expands the more and more you add to it, or the more and more you gut that provision, it provides an opportunity for bigotry and hatred to really be exercised in these healthcare spaces that are supposed to be equitable, that are supposed to be accessible. So how can we actually end an epidemic if you're targeting and harming, actually purposefully and intentionally harming the communities that are the most impacted by all of these issues? Like, I know that we're all aware of the fact that for a lot of people, the face of HIV is a cis gay white man. That's not the case. That's not what the numbers show us. That's not what our statistics are showing us. And like Max said earlier, ending the epidemic, you necessarily have to end the epidemic for Black folks if you expect the epidemic to be gone. And so when you have these other issues, these other policies that target Black folks, target immigrant communities, target women, target LGBTQ folks, especially trans and non-binary folks, you're going to end up in a situation where no matter how many times you say you're going to end the epidemic, your actions cannot follow that. So the conflict has been especially frustrating. It's been something that at the state level, it's like having, I don't know, it's like living in two realities at the same time, because we have the Getting to Zero plan in Illinois, where we have a governor who's on board with it. We have a lot of agencies that are really doing the work to try to make sure that the epidemic is addressed. But then at the federal level, when we talk to these agencies, and I'm sure that you all talk to the same ones, it's like, well, what are we actually doing? Like, what are you actually doing? Where's the money? Where's the policy? Where are the resources? How are you prioritizing communities? What does that look like? And you kind of get met with the, I don't know, but the acronym looks good, right? Like it's not enough.
Yeah, I've been baffled, and it's hard for me to get shocked at this point, but going into a meeting, hearing from federal folks telling us they have a great like slide deck, it's usually the same one for every meeting. So we've seen the slide deck multiple times. They tell us about all their sparkly great plans. And then we're like, oh, is CMS going to be involved with this process? And CMS is the Center for Medicare Services. So it's the federal agency that houses Medicaid, Medicare, like healthcare stuff. And they were just like, oh yeah, I mean, I guess that's a good idea. And I'm like, wait, what? Like, shouldn't medical folks be involved in the Ending the HIV Epidemic plan? Shouldn't that be like a given? And then, we would bring up housing and HOPWA and asking why they weren't involved. And then they were just like, what's the connection? And I'm like, housing is a huge connection. Like, we need housing for people to be able to get in treatment, stay in treatment. Like, they need to be here. And, asking about SAMHSA, when they deal with, injection drug users and just drug use and all of that, they literally just got to the table a few months ago. So just like the glaring incompetence, it's very frustrating. Max, let me hear your thoughts.
Thank you, Aisha, for that wonderful, like, to start off as we talk about this. I use the word lacking to talk about the EHE protocols, but if I would to talk about the administration, I would use the word callously deadly. It is when you have multiple pandemics that are disproportionately impacting certain communities, it would make sense to do something to fortify the healthcare, fortify the services necessary to make sure that folks have that. We have seen in a show just of not care for those people, and we cannot separate this from the also campaign narrative that we would also hear throughout the year of a president saying, "I'm the best for the Blacks." I love these different communities, while literally standing there while a new pandemic disproportionately impacts them. Also, his continued attacks on our healthcare system throughout this to make it even harder for folks to have access to care, and shows in a time where we are dealing with COVID-19, where disproportionately impacted people are not having the proper service for them. And to see people with other conditions also not get the services that they need because we don't even talk about that larger impact that does not allow for folks who are dealing through cancer treatments, needed that knee surgery, needed to go to the hospital for other things, because those hospitals are overcrowded with what they're dealing with COVID-19, makes it harder for them, or even the fear for them, to even go into that system to get what they actually deserve. So then we get to this point where we have people and rising death rates and rising COVID-19 rates, and folks not knowing even how to cope with this, rising levels of depression, and to still have someone at this point who is more worried about if they will be there for the next 4 years or not, even though the numbers do not show a possible path towards that. To still have a fight, or don't have really a fight, or the care to deal with the COVID-19 pandemic that is disproportionately impacting this country on a whole now, in a way that, because it just was callous in nature. And I think about the continued attacks that folks had to advocate against constantly, and shout out to all the work that folks have been doing on the state sides to kind of push back against those. But understanding how even individuals that have different power will feed into that in order to stay into power, instead of actually dealing with what people are dealing with their lives, their day-to-day lives. And it adds a further distrust for organizations and people that are working to try to end an HIV epidemic, to try to help people during the COVID-19 pandemic. And it makes us hard for us to even be able to talk to people about what's going on, because there are so many layers of things that are being not worked through. And we haven't even talked about the economic impact that we have still not seen the full follow through of, how bad this will actually impact not just the United States, but the world, because of how in which it's impacted multiple people's economies. And in March of this year, when Boris Johnson was trying to use the herd immunity plan, it was called out of being callous and dangerous. What the Trump administration has done over a longer period of time, through it not actually putting in proper protocols, moving slowly, not putting in a true federal response, has been callously deadly for multiple communities. But I specifically have to speak to how in which badly it has impacted the Black community.
And I don't think that's a coincidence. Jeffrey, what are your thoughts?
Well, I'm going to have to say I appreciate Aisha and Max's comments, and I don't know a whole lot more that I can add to that. It's very comprehensive. But when I chose the word seedling, more or less referring to the federal Ending the Epidemic plan and what that could be. The federal, that Ending the Epidemic plan, you have this seed, you plant it, you water it, you fertilize it, it grows into this beautiful thing and useful thing that you expect for it to be and that you was hoping for it to be. And this Ending the Epidemic plan has had every possibility to be that. But because of this administration, and if I was going to use a word to describe this administration, for me, it would just be disgust, because I am just totally and utmost disgusted with this administration. It's at a point where I can't hear this man speak. You can't see his face. And every word just comes out of their mouths is just a lie. And as been mentioned by both Aisha and Max, all of the work that they've done to destroy healthcare policies that could have been effective in helping to end this epidemic, and work that could have been done for people of color. What I think this has done, unfortunately, is just to cause non-engagement and more disenfranchisement than was happening before. And as been mentioned, it's vital for people of color to be involved in this Ending the Epidemic efforts, in order for it to be effective. Because if it's not, if the people of color are not involved, this is not going to be an effective plan. And it had that every possibility of being that. Hopefully, with the new coming in administration, that will change. The whole, as much as I love them, we're going to the fire to make sure that they do what they're supposed to do as well. So.
It's so true. When you said the word seedling, I kind of felt that in a unique way, because this plan had such potential. Like, the idea of it is what we've been wanting and been screaming for a while. And it was very weird to hear that announcement come, and then of course be experiencing what we were experiencing. I know there'd be meetings where, we would be having to go talk about HIV related stuff, but then kids were literally just being put in cages the day before. And so our meetings had to kind of shift to talk about immigration, and that oftentimes didn't end well. And so it got in the way of our work. But there would also be times where, well, when it comes to the work that we do every year, it seems like we're always figuring out budgets, always going through appropriations, trying to make sure that there's adequate funding for HIV related everything, Ryan White, all of that. And there'd be times where usually how it happens is like all of the HIV coalitions will have one ask. And it's usually a higher ask than whatever the government's wanting to offer. And then depending on who's politically in power, the Democrats will give like a kind of high number, the Republicans will give a lower number, and there's always just like, we'll figure it out in the middle. But with this plan and around these times, I've noticed specifically around HIV related stuff, there would be times where our coalition will make an ask that would be high, and then the president would bring a higher ask for certain things and want to offer more funds to certain things, but then would want to take away a ton of extra money for things that he didn't think were necessary, like minority health and HAPWA. So it was weird because like there would be two steps forward and be like, oh, whoa, like we got to change our ask because the Republicans will give him what he wants. But then we also have to like fight for the bare minimum when it comes to getting funding. So I always thought that was super interesting how that would work out, but then it's hard to operate in good faith. I'm curious to know from y'all about what y'all have heard from community members about this process. I know that like folks will usually come up to me and just ask me like how things are going, and ask about wanting to get plugged in to the efforts, and just we're curious, have you heard anything from the community about this process and if they've been involved or not? So I haven't really heard too much until way recently with Mecklenburg County. I feel like they had their efforts starting before the President's State of the Union, and things kind of just like kicked off further after that. But I felt like I didn't hear much from other folks about things. So I'm just curious to know what your thoughts are on what you've heard from the community. Aisha, you want to start?
Sure. I feel similarly. So the thing that we have noticed here in Illinois is that because the plan for Illinois specifically was so robust and already had so many things in motion, when the president said something, we were like, oh, okay, I guess we can use this as support for what we're doing. But right now, whenever we talk about any plans around impacting the HIV epidemic, it's really mostly state specific because there is an actual plan laid out there. So I think a lot of the folks who are in advocacy spaces who've been involved in a lot of conversations are frustrated because they feel like the federal level, the words were said, something was brought up, but there isn't actually any movement. And so it's a question of why pay attention to what's happening federally if we already have something happening at the state level that feels more representative, that feels more community centered, that feels more focused on actually talking about things like race, talking about things like healthcare accessibility and housing and connection to care, and making sure that people know that it's not just about being able to walk into a clinic, it's also about knowing like where your next meal is coming from, knowing that your job is stable, all these other things. So there really isn't much talk about the federal plan because, as we've said a few times now, that federal plan is, like Max said, lacking. Like there's nothing there for us to really build upon. And I know a lot of people who've been involved in these conversations since before I was born, and they're like, yeah, federal administrations can be terrible. Like this one is trash. And, we're just going to have to figure out how to make sure that we're taking care of ourselves because the community is resilient. Like our communities are always resilient. We've had to be. We've been forced into these spaces. And we know that at the end of the day, it's us who's going to save us. It's not going to be the president. Like even with the new administration coming in, like Jeffrey said, we're going to still have to hold their feet to the fire. Like there's no legacy of presidents doing the absolute best for our communities because a lot of times they aren't even talking or listening to our communities. So most of the feedback that I've heard is, sure, I guess he said it during the State of the Union and a shrug. And then after that, it's like, okay, now what are we doing really? Like what, okay, we checked that box. We had that part of the conversation. Now can we actually get moving on the things that have mattered and still matter?
Mm-hmm. Yeah, I've been getting a lot of eye rolls from folks. Max, what are your thoughts? What have you heard?
So on around the Ending the HIV Epidemic, and we have with the Black Treatment Advocates Network overlap in 25 different jurisdictions. And of the highlighted 57. And when we look into them, we have leaders that are a part of the EHE planning process. We have different folks who have advocated, done trainings with them. We have helped with the Mississippi Health Department's newest EHE, their latest iteration of their plan. And shout out to Mecklenburg County's Getting to Zero, Illinois' Getting to Zero plan, Arizona, Houston, New York, I think it's New York State now, and San Francisco for starting their own Getting to Zero plans earlier on. But when the community is generally asking about them or talking through them, especially throughout this year, when we say that we're lacking, I think it does actually, come a lot from the community and saying that they haven't seen as much. They thought new monies, new resources would be coming in. Organizations were trying to position themselves in different ways. And we've seen that more on the federal level, but on the natural state level and the holdup in many ways around health departments within this work has made it very hard for them to be able to see any real change. Certain places, and we actually had BTANs in both Baton Rouge, DeKalb County through our BTAN in Atlanta, and then also our work in Baltimore with BTAN Maryland, and to hear and see that even the pilot programs were very slowly formed and not given the proper need that the health department I think really needed to be able to give time to actually plan out, do this in a proper way, but also the health department's muffling of these and not using the funds where community had asked and needed and said that they needed more help in, and not actually allowing for that, but it was also timing within the process and including the timing of this year. It was tough. We add on COVID-19 to an already truncated process of typically doing community engagement, makes that so much harder to actually be done. And where folks are focused on so many other things, it's hard to say that, okay, now on top of that, let's talk through what we're going to do around ending the HIV epidemic, when most of these organizations are like, how do we open our doors? Mm-hmm. So those are some of the things that I think were disconnects and not understanding, and then trying to put a rush process towards the end of this year for folks to be able to put plans together that were working. Now, some of them did do a good job of slowing down the process. Shout out to some folks in Mississippi, our leaders that were doing it in Alabama, always the work of BTN Charlotte, to always, try to stay connected with these process, be within the process and try to have as much information as possible, but understanding that there was a lot of blue tape and a lot of, I think in many places where our health departments weren't being enough honest with where they were in the process because they weren't ready. And that was because of multitude of factors, I think, structurally that are done on a political side, but also because of just what we were dealing with in 2020.
Yeah, it was very frustrating because I feel like, when it came to a lot of the red tape, what happened is like the federal government would be like, okay, here's X amount of money, come up with a plan of how you're going to spend it. You can't spend it on this, or that. You have a month, get community feedback, send it in to us, or you're not going to get any money. And it's like, that doesn't mean that you're actually allocating funds to this community. And in a way, and it's obviously not in a way that's effective and helpful. And so folks have, like you said, Max, have just been trying to stay open and trying to get Wi-Fi, let alone go on the internet and access this federal application, jump through all the hoops, and maybe get funds. Jeffrey, what have you heard from the community about this process?
Well, in Mecklenburg County, because of COVID, hadn't been able to get hearing a lot from the community at large, but with our Getting to Zero efforts, which we have, the federal Ending the Epidemic plan has now become part of our Getting to Zero. So we have been able to make some strides in Mecklenburg County. We've submitted applications, the information NOFO gotten awards, and been in the planning process. And actually, a good percentage of the funds that we will be getting will be put out into the community in RFPs and put out to the community. Actually, the majority of it to community-based organizations and ASOs and et cetera. So we're getting, keeping people informed through our meetings that we're having via Zoom, and also through emails. So folks are getting the information, but right now, things are starting to slow a bit because, with Mecklenburg County Public Health being a local government agency, and with COVID happening, everything we do have to go before a Board of County Commissioners, because in Mecklenburg County, we answer to a Board of County Commissioners and not a Board of Health. So everything we do have to go before the Board of County Commissioners, and they don't meet again to December 1st. So we've been able to make some hirings and get some stuff into place. So people are hearing more about it and getting more excited about it and what they could do. So we are a little further than some, fortunately.
Mm-hmm. And, it does show that, that having time and actually putting in the effort to do this work does pay off, but you need all of that. You can't just, expect magic to happen and you don't give people the resources to do it. And, I'm grateful that Mecklenburg County has, been active in this process and has continued to do so. But there have been challenges, for sure, particularly in the beginning, around, community engagement and what that means. I know that, and it's not unique to Mecklenburg, but there have been situations where, we'll hear about the ETE plan and folks will want to get plugged in, and then there's no real opportunity for meaningful community engagement. And I feel like during our meetings with the federal folks, we would always ask, because they would say like, oh yeah, this happened, we're doing this, we're doing that. And it's like, who said that they needed that? Like, what community engagement meetings did you have? What forums did you have? Where's the data from these? Where are the notes from these meetings? And then it's just like, crickets. And so then I would like ask folks who like legit worked in the field, like folks like, like Max and other folks around the state or around the country, and just being like, are there meetings happening around you that you've heard of? And it's like, no. And then it's like, wait, so then what's going on? What's going on? Like, how are they, quote unquote, meaningfully engaging with the community? And maybe I'm wrong. Have y'all heard stuff in the community about, meaningful engagement and like what has that looked like for y'all when it came to this plan? Because I feel like I haven't seen or heard of many efforts. And I just want to say, like, I did get an email from federal folks about like a virtual Zoom that they're doing for the ETE. I think they're doing like regional ones, but it is November 2020. So we've been in this process for a while. So I'm not going to be like, going to give you a gold star, but it's like, okay, they're doing that next week. But aside from that, like, have y'all heard of anything at all, really?
Not
No.
for me, not federally. We have meetings with our contract consultant, but that's I don't think that's very effective.
What about you,
So,
Max?
We have had some meetings throughout the year with Harold Phillips, who is, I would say, has been a diamond in the rough of individuals working to really move the ending the HIV epidemic and trying to hear from community. Also with tons of red tape and other things also connected with that. And also members of the CDC and HHS and just trying to and HRSA throughout the year to try to get more understanding of this. There is also a meeting with PACHA, the Presidential Advisory Council on HIV and AIDS, which will probably be the last meeting under the current administration in a couple of weeks, which I'm sure that they will give further updates around the ending the HIV epidemic. But there will be also a lot of questions, right? I think the major things is around the first thing that we know the next administration's focus is COVID-19. I think the focus will be still around COVID-19, but still making sure funds are allocated around HIV. We have had tireless advocates to make sure of that. I think we will be at an impasse of trying to understand what is the future of the ending HIV epidemic in 2021 and thinking how in which we move it. And also thinking something that we had talked to Harold about before is the National HIV/AIDS strategy. And that, how does that flow into this? And different organizations talking about how do we take the different pieces of those strategies that are good in order to move for further formation. This year would have been typically the year if we were doing the National HIV/AIDS strategy, this would have been the reformation into a 2025 goal. So thinking about using that strategy along with the different strategies that we've seen and I've seen led from the people, including in Mecklenburg County, to talk about how in which we can truly talk about ending the HIV epidemic in these highest burden jurisdictions along with the rest of the country and making sure that everyone gets the services that they need.
Mm-hmm. Jeffery, I want to ask you a specific question. So I know you've been involved in both the federal and state efforts. And, you know, community engagement to me is something that I feel like is key and crucial to any of our work, but specifically this process. And it enrages me that that hasn't been happening. And I'm grateful that in North Carolina, you know, we've had a better chance with that. And I think that does kind of tie into what Aisha was talking about. I'm having to like work on the state level and have, you know, a more agreeable governor and state agencies who are wanting to move things forward and having a different situation on the federal level. But I believe in North Carolina that we did a really good job with meaningful community engagement, like not to toot our own horn, but like beep, beep. I really do think that we did a good job because it took time. It took time to go out to all the different cities. I put a lot of mileage on my car and I loved every second of it because I was able to actually hear from folks about not only what they needed, but how they needed it and how they needed it in that specific part of the state. So Jeffrey, I want to hear from you, just kind of doing like a compare and contrast of how meaningful community engagement looked like on the state efforts compared to the federal efforts in Mecklenburg.
I'm going to say first, I want to make a distinction when I talked about the getting to zero, the Mecklenburg getting to zero plan, and talked about the federal plan. So Mecklenburg had the getting to zero plan, I think started like 2017. We had that getting to zero plan well before there was even a state effort, and definitely well before a federal effort. And so I guess I'm going to talk about them in that comparison. But as far as for meaningful engagement, for me, I agree. I think there was a lot of meaningful engagement involved in both the state ending the epidemic efforts and along with the Mecklenburg/federal. And because the Getting to Zero plan and the federal plan was similar, the things that the federal plan was calling for was things we were already doing with the Getting to Zero plan. That's why we kind of tied those together. And there was a huge effort. And I think when we're talking about getting meaningful community engagement, just that word intentional and being intentional comes to me, and having all the crucial individuals involved that are vital to the success of the plan, and those be involved, not just being involved in this decision making and the planning, but but the implementation in all phases of the plan. And it's essential that there's Black, brown people living with HIV, AIDS, the LGBTQ community, and faith-based issues, individuals involved. And I want to make a note about faith-based communities while I'm there. I think it's important that we ask them how they want to be involved, as to try to tell them where they fit. I think that may be one of the reasons why that will help get faith-based community more involved. And I'm going to have to put a plug in for the HIV 50 plus group, which I think is forgotten about quite often. But and it's essential for communities of color, and not just only when we're talking about community colors, but talking about Black SMSM, but trans women, Black women, heterosexual men. And because it's vital that people of color be involved in this plan in order for it to work. And when we get back to talking about meaningful engagement, I think both plans, the Mecklenburg County plan, the federal plan, and the state plan, did a great job, as much as possibly could be, with having the involvement of the community and having that community intentionally involved. As you mentioned, with the state getting the effort plans, going around the state and having these listening sessions. With our plan, the federal/Mecklenburg plan, we hired the Black AIDS Institute to do focus sessions, listening sessions, and to come up with like a needs assessment plan. So in comparison, both plans have been a lot of effort in getting that meaningful community engagement. In contrast, the state
ahead, Jeffrey, let it
done
out.
a lot of work.
Go ahead.
I'm sorry.
Go ahead, Jeffrey. Don't be shy.
The state put in a lot of work with their listening sessions, and we got back together as a steering committee and put together some strategies. And I think probably more could been done on the state plans and done sooner, but I'm going to say COVID happened, and a lot of the state folks got involved with the COVID-19 issues, as opposed to we had a designated person with the federal plan for Mecklenburg County that was able to continue to move those efforts and keep that community engagement involved. And we're still having listening sessions and working on getting stuff out to folks. So the contrast, I guess, is that the Mecklenburg County plan, we had someone designated that was going to be a focus. We've made this ending the epidemic plan a priority, even in the midst of COVID-19.
It's true. I mean, and it's really a gift to have someone on staff tasked with that. I know at the state level, that person got taken to COVID, and that's what happened there. But there actually have been listening sessions still going on with the state plan. There was some feedback that we weren't able to gather in the 11, 12 other meetings we had. So we actually had some more focused groups these past few months. So the plan is actually still in process and still moving forward. It's just moving at a slower pace. But yeah, no, I think those are important to highlight. The next question I wanted to ask actually kind of came up in the chat, and I want to talk to Max and Aisha about, what your thoughts are when it comes to meaningful engagement and what y'all think that means. I'll read this question from the chat. It says, what does exactly community engagement mean? Even when there is research, I feel a part of community engagement is including the participants in all levels of the research process. So often participants do not know the research results. That's true. In the efforts of community engagement, we need community partners from the faith-based community to the law enforcements. We need people who are both positive and negative to be at the forefront. What about trans men? What about the heterosexual man and woman? So often the voices of these communities are not heard, and the lack of data proves so. Thanks, Lisa, for putting that in. Aisha and Max, what are your thoughts on community engagement? What does that mean? What is that supposed to look like, in your opinion? Aisha, you can start.
So I saw that question come into the chat, and I was like, this is a perfect pivot. I agree, right? So one thing that we often hear is this, like the analogy about having a seat at the table. And honestly, that's not enough, right? Like it can't just be that you invite folks to a focus group. It can't just be that you ask them to come to your advocacy day. It can't just be that you like talk to them and ask them to take a survey. It has to be an engagement all around, right? It's not just coming to the table to eat. It's also knowing what's going to be served, knowing who's cleaning up afterwards. You know what I mean? Like, it's not just about these single touch points. And I think that that's a thing that happens a lot of times. And it's not even just within the HIV communities that we serve, right? It's also any demographic group that is either considered a hot topic of conversation, or where there's any kind of resources or funding related, because people like money. Like there will be folks who try to figure out how to get involved in these things for that single touch point, so they can say, okay, I wrote this report, now we can get more funding, right? That's not enough. Having meaningful engagement means that you care about what that advocate is doing on your advocacy day, but also before. You want to make sure that that person is not stressed about daycare for their kids, worried about getting fired because they decided to come and spend 8 hours with you down at the Capitol building, making sure that you actually care about them when it's not open enrollment and you need someone to come and be on your panel and talk to people about something, right? Meaningful engagement is not just, organizations or groups or however they describe themselves, using people as a talking head or using people as a statistical data point, right? And a lot of the work that needs to happen to make sure that that doesn't happen is involved in building trust. There are a lot of organizations that people don't work with anymore, that I don't work with anymore, I won't work with, because there isn't that meaningful engagement there. I know that they only do that single touch point and walk on and move on. They'll give you a gift card to Target and expect that to be enough for you to make sure that all your needs are met. They'll get 2 hours of information out of you, put in a 30-second video that goes viral, but all you got was $25 to go across the street. Like, that's not enough for us to actually say that we're doing meaningful engagement. And it goes back to all of these other issues that we're realizing at every single level, right? Even when it comes to medication, when you have a commercial that doesn't even feature a Black woman in it, right? When you have a commercial that you don't even see yourself reflected in, talking about PrEP, talking about medication that you're supposed to be accessing, even though you know that you're disproportionately impacted, it kind of makes you frustrated, and it also makes you pissed off, right? There's no reason why I have friends across the country texting me like, okay, listen, girl, I know you're now at AFC, so what is this about this commercial? What is PrEP for me? What does that mean? And I have to look them in the face and say, oh, they didn't actually test on cis women. They weren't intentional. They didn't meaningfully test on trans men. They didn't actually talk about what this medication does for Black folks. And when we're talking about the COVID-19 pandemic, it's a whole nother situation like that, right? I was in a conversation with people who were like, well, we need people to take this vaccine. We need people to trust the science. We need people to do this, that, and the third. And I'm like, do you not understand that when you're saying we need people to do these things, you're not actually acknowledging the centuries-long history of distrust, of rightful distrust of these systems? I had someone tell me that the reason why we need more Black folks and other Latinx folks and like Indigenous folks to sign up for these tests, to be in these trials, is because we won't get a better vaccine if we don't. And I'm like, why do you think any person from any of those communities would volunteer to be a part of what they think is a medical experiment? Do you not know about Tuskegee? Have you not paid attention to all of the immigrant women being forcefully sterilized today? Do you not pay attention to the history of reproductive injustice that is forced upon people who are in detention across this country? Like, it's extremely infuriating and very frustrating, because at every single level you have to push back. And then when it comes to going into community and talking to folks, there is a need, it's a necessary thing for people from organizations who are advocates, who are paid to do this work like me, to understand that if I walk into a room and I'm met with distrust, that's not because I did something personally, right? I don't deserve trust just because I walked in and I have Esquire at the end of my name and I have a cute business card, right? That's not enough. I have to actually show and prove over time that this is not just me doing to folks what other people have done. And I refuse to do that, because I'm not about to be the Black face of white supremacy for all these other folks in these groups and these agencies, right? And so I think that you're absolutely right, Lisa. It's not just about saying, hey, come and be a part of this study and not tell people the results. It's not about saying, hey, do these things because we think that it's the right thing to do. It's about making sure that you're actually listening to people and realizing that at the end of the day, they do care about PrEP, they do care about data, they do care about research, but they care more about making sure that their needs are met at the end of the day, that they're not having to jump through hoops to get access to care, that they're not jumping through hoops to be able to go to a grocery store, that they're not jumping through hoops to avoid or dodge or not be harassed by law enforcement. And you're right, there has to be some way to bridge gaps to make sure that people are all brought into the conversation, because it's not incumbent upon people who have faced discrimination to educate other people about that discrimination. And that goes across the board. It's for people living with HIV, it's for LGBTQ plus folks, it's for Black folks, it's for Latinx folks, it's for immigrant communities. You can't expect folks to trust you immediately and also give you all the information and also help you meet all of your grant specs if you don't show that you care about them for real outside of your grant period.
Folks love adding their love for people or certain communities on a grant application, but those folks can't even use the bathroom at their clinic. So it's just maddening to see that happening. Max, what are your thoughts on meaningful engagement? What is it supposed to look like?
The basic understanding of what community engagement it is a collaboration. It is a collaboration of the folks that are being most impacted to involve themselves in whatever work that you are doing on that particular community. And it shouldn't be a one-time thing. We have allowed it in because of the grant formations, as Aisha had talked through, was like, this is the system that we have created. And it is incorrect in how in which it should be done. When I think, and I am lucky enough that I have actually been a part of both Illinois' Getting to Zero program very early when it started, and also got a chance to see different parts where Black AIDS Institute was engaged in Mecklenburg County's Getting to Zero. I did see definitely the meaningful involvement of folks trying to get them engaged, but also there's an understanding of, could there have been more done? Yes. And I think even with our work in Mississippi, our work that we've done here in Atlanta, there's always more that could definitely be done in different advocacy ways that we could do. I think there should always be allowed more questions, more time. And I also don't see a problem necessarily with slowing things down to allow for community to truly understand and have a understanding of how in which this is done. I think that is an important part of the actual process, is making sure that community has an understanding of it. Because when there is more buy-in, it becomes a greater outcome in the end. when they also get to see, and and thank you, Lisa Johnson, led for putting out this question. It is important for us to continue to have that engagement. They should see the end goal. And if the end goal, we didn't get to that end goal in whatever process we were going, we need to tell them what's the next thing. What is that next piece to get us to that next piece? Where are we lacking? When we do a breakdown, and I will give you an example for our We the People report that we just did. And the reason it's called We the People is because we engaged the people throughout the process. We literally had informant interviews, over 30 informant interviews, did town halls in 3 different parts across the country. And I still felt like there's more folks that I wanted to reach out to, send out multiple surveys to folks. Then had focus groups with folks that worked in health departments, that was community that was engaged in different on cabs, community that also just didn't have as much of a connection with HIV, that actually had more transitional issues connected to it, that were more housing, criminal justice reform, different things that weren't directly HIV related, but still connected to that larger issue. And that allowed for us to put in together that report. And still, we needed more time. And we're still taking in input from community as we are trying to understand how we get to the end of that campaign of ending the HIV epidemic, because we also understand we do not have all the answers. And each community understands that they have those answers, and we have to continue to get that feedback from them. So all of that's important as we're doing it. I do want to touch a little bit more on something else that Aisha really, not putting folks who have been oppressed in processes where they have to then meet with the folks that are harming them to tell them how in which they need to do better. There are some times in which we have put this out in multiple different places. If these organizations aren't going to be accountable to the people, if our systems are not going to be accountable to them, we must divest from those systems as institutions and decide we're not going to get our services done there anymore. Or our folks should not have to be harassed in this way. No trans woman should have to come into a space and be misgendered or have to be treated in any way that doesn't see them in their full dignity if we are giving them services and access to also the information within our bodies. So that is an important thing for us to think about. And if they are impacting anyone within our communities, we should then also rally up and say, like, this is not enough. You must be transformed in this process to do better. And also show folks inherently, this is what we are doing. These are the steps we are taking to do better around this, and racial justice, and dealing with transphobia, and dealing with also not allowing for some of the communities that aren't highlighted as much to also feel safe within our spaces. And I'm always about also working with Black cisgender straight men about talking through the work that is important for us to also in the HIV epidemic. But if you're gonna come here with homophobia, with not understanding some of those pieces, then there's some work we got to do, pre-work that we got to get done before we can get you to the larger body and connect it to the larger work we're going to do. And then another piece I want to touch on is around thinking about when we also, if we're talking about a major impacted community and who we're bringing in, we have to talk about if the majority of folks that we're talking about are Black youth, Black queer youth in different spaces. Bringing in faith leaders may be extremely traumatizing. Being in law enforcement may be extremely unsafe for them. And so understanding that also the community that you're trying to serve, the most important folks that you're also trying to get and with that meaningful involvement, that making sure the people that are most impacted are getting that information. On the next side of that, understanding the other communities that are important for this have to be educated, constantly engaged themselves. Also have to take in their own commitment to do the work, to truly do the meaningful engagement that they need, to make sure that they understand how in which they can work together. All of that has to be taught.
Yes, I literally had to talk to a group of folks from like health departments across the country doing this ETE process about meaningful engagement and what is needed. And I was telling them what you were saying, that it takes time. You cannot just think that you can send out a survey and be good. It's gonna take effort. It's gonna take time to build relationships. And you should have seen their faces. They were just like, we have deadlines. And it's like, I don't care about your deadlines. you don't have a Black person working in this health department. You have a lot of work to do. And it's baffling to have these conversations with folks about the bare minimum of what they need to do this work effectively. And, you know, I feel like I want to continue talking about this, but we're going to shift a little bit. I feel like this past summer, you know, most of us have really, I feel like our country has been experiencing like a cultural shift around racism and the existence of racism. The fact that, you know, some folks are, you know, mistreated by the police and have different experiences with law enforcement than others. And, you know, it seems like some folks have just discovered that racism is a thing and that systemic racism impacts stuff. And it's like, I say some folks because obviously as like Black folks, like we've been knowing that racism is real, you know, like Black folks, like Latinx folks, like we know that this is something that is a part of our reality. And it's been interesting to see some folks kind of come to that realization. However, you know, we find that, you know, even in this space, in the HIV space, I know that there have been efforts to center Black folks and to, you know, just look at the data and notice that, you know, Black folks are disproportionately impacted by HIV. So we need to, you know, work to fight racism. That way we can end HIV in the Black community. Yet, you know, we know that there are even organizations that we work with that are a little iffy about even mentioning racism, or even scared to have the conversation, even scared to even say the term white supremacy. You know, like that, that is something that some folks are uncomfortable even talking about. Yet they get grant money and claim to serve Black folks, and it's very frustrating to experience that. I'm curious to know from the group, you know, what impact does refusing to acknowledge racism have on this ETE process? Aisha, I'll start with you.
It's hard to even figure out where to start with the response to that, because there's no part, as a Black woman, there's no part of my life that's not touched by race, right? Like it just doesn't exist. And whenever there are moments in spaces with organizations where there's this hesitancy or refusal to talk about things or to be honest about them, right? Like there are a lot of folks who want to skate by on very shallow understandings of what it is that we're talking about. There are people who will say, you know, we should post this statement, or let's put this picture up, or let's retweet this thing, and that will be our way of letting people know that this is something that's important to us, without making any other changes. And that's not enough. And it actually is more insulting, in my opinion, right? If you don't care, don't act like you care. Like just let us know that you don't care, and keep it 100 with us. Like it's okay. And so I think that this larger conversation around race, around understanding just how deeply impacted different communities have been for years, for decades, for centuries, not only with law enforcement, but with every other aspect of our lives where the state is in control of things. So when we're talking about Medicaid access, when we're talking about Medicare, when we're talking about the ways that people, especially Black, Latinx, and Indigenous people, are treated, right? Like I can't pretend like this is not something that touches every single thing that we do. And so when we were having, like, I mean, I've been in a number of different conversations, not just at AFC, but with other organizations, where people were like, okay, let's think about this thing. Like, let's keep going. We have a strategic plan. We have these things that we want to do. We have these grants. We have these deadlines. And I'm like, I don't think you understand the impact that, I don't even watch the videos anymore, but like the impact that knowing a video is out there, right? The fact that every time I see someone post someone's name, I am immediately on alert about what happened. And I'm afraid that that's another person who's been killed. The fact that whenever people are, I remember being on a federal call on Wednesday, November 4th, when a lot of the numbers were in, but we didn't have any like solid answers. There wasn't a declared winner. But there were people on the phone, white folks, who were very excited. They're like, oh my gosh, like it feels like we're gonna be headed into a new administration. And like the silver lining is that, you know, although we're doing this work right now with them for the next few months, there will be something new in January. And I'm like, I don't think you understand the impact of seeing more than 70 million people in this country continue to vote for someone who has not only like not done anything for us, but has actively worked against us. Like Max said earlier, like this person has intentionally and purposefully harmed communities that I'm a part of. And I'm supposed to celebrate even though 70 million people still voted for him. Like it's almost like if it feels like there's this insurmountable hurdle at times where people who have not had the same lived experience or a similar lived experience don't kind of see where this is impacting us all the time. And so it becomes a situation where we're doing two different jobs at the same time, right? Like we're talking about figuring out how to get to zero in Illinois. We're talking about ending the epidemic. We're talking about all of the things that the research and the data and the numbers are showing us. And we're talking about how, you know, this isn't the first time you should have been talking about racial equity. This isn't the first time we've dealt with a police officer murdering an unarmed person. Like I don't know. I don't even know how to like put all the words behind it, but there is no way for us to get to zero. There is no way for us to be successful in making sure that the epidemic is like handled or ended or treated or whatever without having this proper understanding about how much race impacts folks. I don't know how many people I talked to the day that we found out that the murderers of Breonna Taylor were going to walk free, right? I don't remember how many conversations I had with people working in any social justice field you can imagine who were just devastated. Like they're talking about how I have 8 meetings today, but I can't even figure out how to form a thought without this coming into my mind. I remember waking up that day and thinking, I have to actually sit in these spaces. I have to actually be productive, right? And still counter the emotions that I'm already feeling about this. I'm a lawyer. I'm a Black woman. I am someone who could go into a courthouse right now and argue a case. But I also know that right now I could get shot through my wall right now. I could get shot through one of these windows right now. And I cannot trust that there will be justice for me. And so to have to deal with that, to have to live with that and sit in that all the time while also trying to do all this other work, there's no way that I don't bring that into that space. There's no way that I will ever not bring that into that space. And I have to. And I agree that there's a level of work that we as people who experience this bigotry, discrimination, and hatred, we always do, and we've always been asked to do, but there's also work that has to be done by other people, right? Like it's not enough for us to do it. It's not enough for us to come in and bear our scars and share our stories and cry and mourn and grieve and do so publicly. It doesn't matter if we don't have other people who are standing with us, right? This is not enough for us to continue to yell it because we've been yelling it for forever. It's not enough for us to keep doing that. And if we have people who are committed to the status quo, committed to doing things the same way that they've been doing, then we will never end the epidemic. Like I've said that to people numerous times. If you can't say strongly and boldly that you are committed to ending white supremacy, to dismantling all the systemic racism that exists around us, you don't actually care about ending the epidemic. And if you can't stand in that, if you can't realize that, then I don't know if this is the work for you to be doing.
Oof, Aisha, you touched on something very real, very real. Max, talk about it. I mean, can we end the HIV epidemic without addressing or acknowledging racism?
Not at all. I don't think it's even possible. It's the blind spot of the ending the HIV epidemic. Is the blind spot of many of our different important work that we say we're doing. If we look at the housing crisis, if we even look in like how in which our healthcare system has addressed COVID-19 to many other I think different things that have even been talked about, even in the chat, where folks just don't address it and understanding the racial inequities. You know, it means having to take into account medical mistrust. It means taking into account years of what slavery and systematic and the social determinants of health impact someone's ability to access quote unquote good health. I think we have to go further than telling. Well, I think it's important for folks to say something and do something about it, but there has to be so much more. Like there's so many other layers that we got to get past that. There has to be plans to deal. We make more plans, strategic plans to deal with anything but race in a lot of the organizations. We have to have, like, if that's not actually embedded into the strategic workings of the organization, it's not going to be addressed. If it's not addressing in the policies that you will address and say, understanding, and this is something that I truly believe in, is intersectional solidarity. And this goes back to something you had talked about, Christina, when Trump's administration would say we are even going to put more money in a particular HIV thing, but take a bunch of money from other things that we actually need, including the housing work. And then have also continued tax against Planned Parenthood. I'm not just about to take this from you when I know that the other folks and the other things that we are being impacted by are still going to be hurting. Because I am understanding intersectionality as a framework, understanding that I am in that your struggle is also connected to the struggles that we have, and also understanding that there are certain of us that are more privileged and more oppressed within this system, and that we have the folks that are dealing with multiple levels of this, we need to also uplift. And also understand the action of solidarity, which is also showing up for folks, even though it is not something that necessarily impacts me. Putting those two together, meaning that the work of whatever organization, no matter who leads it, is actually doing the work that is necessary for the most impacted, for Black folks, for Black gender non-conforming and queer and transgender individuals, making sure that we are actually doing that added work for formerly incarcerated folks, making sure that we're adding those connection points, and that community is constantly engaged throughout the work that we're doing, and not just on a cab, not just for a couple gift cards, right? Like they are community, and they are also hired within. They are given decision-making, understanding. They have access to the board. They also, within that, all of those different pieces, we are continuously being assessed around how in which we are doing around racial justice. What strategies have we done? And also presenting it to everyone so they know, okay, we've done a little bit. Now we got some more work to do. Those are the pieces that organizations actually need to put in place for us to actually address racial justice over a long-term period. And also understanding that can be also reproduced when we are talking about gender justice, when we're talking about how in which we're making sure that queer and non-binary folks are also integrated into our work. That can all be done in making sure that something that the Black South Rising, which is a group of Southern HIV advocates, has put out, is fund us, by us. Make sure, the community is putting in, but also all these big funders, y'all funding the people that y'all are actually doing this work on. And then making sure that those communities are actually doing that work, continuing moving forward. Those are some of the pieces that we have to integrate as we're talking about, Black Lives Matter, I believe in racial justice, in white supremacy, then actually put your money where your mouth is.
Mm-hmm. Jeffrey, what are your thoughts?
As you know, the B10 Charlotte came up with the slogan, racism is a public health crisis. And now Mecklenburg County Board of County Commissioners has chose to make that a priority, that racism is a public health crisis. I don't think that there's going to be any way, shape, form, or fashion that anywhere across this country we're going to end the HIV epidemic, as we've mentioned several times, unless the Black communities are involved. And that is not going to happen when you have situations where Black communities, people of color will not even come up into the health department to receive services because one, you don't have people look like you, or you have people who are not culturally competent, who understands, or that you're able to relate to, or that are able to relate to you. And I think that's one of the problems that we're having, is that we want people to come in, and I'm going to use our health department, for example. Mecklenburg County has required that every individual, every staff member in Mecklenburg County take cultural competency training, and anti-racism training. But taking the training and putting it into practice is not the same thing. It has to be something that's continuous, and it has to be something that practiced. Because you still hear, well, why are they late for their appointment? They're going to show up 15 minutes late for their appointment. You don't know what that individual had to go through in order to make it to that appointment. And because I work at the Bates Ford Road location, which is on the northwest side of Charlotte, which is the side of Charlotte which receives the less amount of attention, and there's so much stigma associated with, because that's the Black side of Charlotte. And so people already expect, when they come into the health department, that because it's on the northwest side of town, that they are not going to receive the services as they do for our location on the southeast side of Charlotte, which is the more affluent part of the county. So dealing with racism, then having folks come in and doing that, and if you're going to come into a location where you're coming in to see a professional, and that they have that mindset, and they're treating you that way, and then they're talking to other employees about that, and it's up to each and every one of us, when we hear that, to address it on the spot, and not just say, oh, I'm going to let that go by. Because if you let it go by, then you're just contributing to the problem. And that's been one of the things that I think has been one of the huge issues and huge hurdles, and getting people of color at least into health services, and already dealing with medical mistrust, and et cetera. And I want to thank Aisha and Max for the excellent points that you have all made, and amen and preach, because they have been outstanding points, and I appreciate all of your comments.
Mm-hmm. Aisha, I want to follow back up on, I think, something you referenced and all of the goodness that was said. You were talking about like multiple layers of oppression, and obviously as a Black queer woman, fellow lawyer, like I felt all of that with you on that. But sometimes there is confusion as to naming racism, specifically anti-Black racism. And sometimes there comes like conversations like, oh, well, there are different forms of oppression, or other groups being oppressed. Like how talk about the importance of naming anti-Black racism and the impact that has on addressing all forms of oppression.
The mute button doesn't like me this morning. So yeah, it's a conversation that I know you and I have had already before, about this idea of figuring out how to truly uproot white supremacy and all of these forms of systemic racism, right? So a lot of times people will hear that combating anti-Black racism is central to this work as either ignoring or not showing enough interest in the forms of oppression that affect groups that are not Black folks, right? But at the end of the day, what we have to realize is that, like Max said, like Jeffrey said, all of our struggles are intertwined, right? Intersectionality is a huge part of all the work that we have to do. And we also have to acknowledge that a lot of the systems in this country were explicitly built on anti-Blackness, right? And that's not to disregard the genocide against Indigenous folks that continues to this day. You know, it's not me ignoring the missing and murdered Indigenous women, right? That's not me ignoring the way that the president specifically targeted Latinx communities, especially Latinx immigrant communities, right? This isn't us ignoring or discrediting or belittling any of these other aspects of oppression, right? It's our way of saying, we know this all exists, and we must acknowledge the fact that in this country, chattel slavery perpetuated against Black folks, the way that all of the medical testing and experimentation and harm that was done against Black folks purposefully, the way that voter disenfranchisement and suppression has specifically targeted Black folks in this country, right? It's about the fact that it was written into founding documents of this country that Black people just are not people, that even when you counted us as 3/5, it was not because you saw any percentage of humanity within us. It was because you wanted to make sure that the Southern states had the representation that they wanted to have in these federal spaces, right? So the fact that we were used as pawns, that we were used as property, and that we're still viewed as less than and subhuman in a lot of ways and treated as such, centering that is why, you know, centering that is necessary for us to even combat all the other aspects of it. And, you know, I really do have to shout out Max for saying this earlier, like all of our struggles are intertwined. There's no way for me to find a way to untangle all of the strings of racism in this country without striking and hitting upon the strings that are tied to other people that are not me, right? All of us are in this together. And when we're talking about, specifically talking about addressing anti-Black racism, it's not in a way that says that Black folks are better than anyone or should be considered more than anyone. It's a way to acknowledge the fact that Black folks have consistently seen the worst health outcomes across the board, seen over like criminalization across the board, seen so much police violence across the board, seen anti-immigrant sentiments as well, right? Like we can't act like immigrant conversations don't include Black folks, right? We can't act like any of these things do not necessarily include conversations around Black folks. And so by attacking anti-Black racism, by addressing the folks who are the most marginalized, who have been pushed out of society the most, that is how we make sure that everyone succeeds, right? When we're talking about intersectionality, when we're talking about multiple jeopardy, we have to recognize that it's not surprising, it's not a coincidence that Black trans women have one of the lowest life expectancies in this country, right? It's not by accident that Black people are more incarcerated. It's not by accident that we don't have grocery stores, that we don't have health centers that people trust, like Jeffrey said, right? The distrust of what a clinic will look like in our Black neighborhoods, right? It's not an accident or a coincidence that all of these things are happening. It is specifically done and targeted at us, right? So anti-Black racism, solving that, addressing that, really confronting it head on means that by proxy, all of us succeed, right? So that rising tide will lift all of us. And so if we're not looking at anti-Blackness, we're not going to be able to actually solve any of these issues that we're talking about. That includes the HIV epidemic, but also all the other tangentially related issues that we all have been talking about, right? And this question of solidarity, like Max said, again, like solidarity and showing up for folks does not mean that we're asking you to not name the issues that are hitting you, that are affecting you, right? That's not us asking that you don't speak your truth and you don't like stand on the front lines with us. That's us asking that when we're doing something, you acknowledge us, you give us our credit, you don't try to talk about like how your team also did this, right? Like if we're in that moment where we have done something and we've accomplished it, you should be cheering us the way that we cheer you. If we have a program that we're doing that is working, you shouldn't be saying like, well, why didn't you do this in my community? No, you should be asking us how we replicate it, how we use that as a pilot and make it better and grow it out and make sure that it does address more things, right? It's not a competition. we have to move away from this scarcity mindset that if we're centering Black people or Blackness, that it's taking away from anyone else. By centering Black people and Blackness, what we're doing is making sure that we are addressing the folks who have been impacted on so many levels for so many years from before this country was a country. So there's no way for us to be successful across the board and all of these things that we're doing, all the work that we're doing, without actually centering anti-Black racism.
Max, Jeffery, you have anything to add to that? Any thoughts?
It looked like Jeffrey was saying something.
I just said, I don't know how, I don't know if I can add anything to that. Preach, Aisha, preach.
Yeah, in complete agreement. One thing I wanted to take to even a further level is I believe Black people should stop being treated as capital. Stop, as we were put on originally within this country, stop treating us as capital in the same way in which we think about the grants and the numbers of folks that we want to get doing. We actually take some of that very strongly from the strong advocates and history of advocating from the HIV community of being, no, you will make sure that we are a meaningful involvement and a part of this. And we must always continue to go back to that and believe in those Denver principles and add on to it the understanding of racial justice as we see it. And I want to shout out Jeffrey is a former Black Treatment Advocacy Network Charlotte chapter co-chair, and shout out to Dante, who is also on this as well, who's been a continuous leader within that chapter. One thing, the declaring racism a public health issue is going to be a recommendation that we'll be sending to the Biden administration, because anyone, especially a person who goes in off so many Black people's votes, should also make sure that they are doing the right thing moving forward. And thank you, and we want to give direct lineage and understanding of that from the BTAN Charlotte chapter. Thank you.
So true, so true. Jeffrey, do you have anything you wanted to add?
I don't think there's anything I can add to that, Christina.
Yeah, no, and I'm thank you, Aisha. And I asked you that specifically because it's a complicated conversation to have, especially in doing this work collectively with our friends. It's like you don't want people to be thinking that we're trying to only prioritize one group and completely neglect, other groups' issues. It's like, no, those issues are our issues. There are Black folks who are also Latinx folks, like there's a lot of overlap. And it's like you said, like if the trans Black woman had all of her needs taken care of, everyone else will be taken care of too. I think that's so important. I'm glad that we're able to detail that more. I'm curious now to know from you all, now we know that we're going to be having a new president, which is exciting. And, I'm assuming this ETE plan is still going to be happening. What do you think now? How do you think now will be different? What are you hoping for? I think that, I'm cautiously optimistic. I do think that Biden will be a more fair actor in all of this. I'm not questioning his, competence or who he'll have working in the agencies and stuff, but I'm also a bit concerned about his position on healthcare, and just it's not as bad as the other option, but I'm not fully convinced that everyone is going to be taken care of, and that gives me pause. And I feel like we're going to have more nuanced conversations as to when we say that healthcare is a right, we mean that for everybody, not for folks who just have healthcare through the marketplace, through Obamacare. Like not everyone has that, So I'm just more concerned about more nuanced things. But I'm curious to hear from y'all. What are your hopes, fears, thoughts of how the planning process will move forward under a new administration? We'll start with Aisha.
I have to say that I have to echo what Jeffrey and Max have both said about racism being a public health crisis, right? And I think that when we say that, it's easy to fall into this pattern of pathologizing these communities and thinking that there's something that these communities have done or that there's an inherent issue within them that is causing these health disparities, when in actuality, we know that that's not the case, right? So I think that we must elevate conversations around the social determinants of health. We must actually think about the ways that we are treating people as a whole, right? When we're talking about ending the epidemic, when we're talking about efforts to reach out to and stay in contact with communities that are impacted by HIV, it's not just about, what the HIV treatments are looking like, what PrEP is doing, all of that. It's also about, healthcare, housing. It's about job security. It's about making sure that people have access to food and nutrition that they need. So I think that with this new administration coming in, I would like to see them highlight that. I would like to see them actually focus on addressing the social determinants of health, right? Because just being born a Black girl in this country automatically put me at a disadvantage, and that should never be the case, right? There shouldn't be any person born in this world, and I'm not even here for the nationalist side of that, right? Like any person born, any color, any gender in this world should not be at an automatic disadvantage just because of that fact. So my hope is that folks who are the most radical, and proud to say it, the ones who are the furthest left are not pushed out or pushed into the secret part of the Democratic Party, right? Or even if you don't associate with the Democratic Party, I'm tired of people feeling like they have to be centrist. I'm tired of people feeling like they have to constantly make these concessions. We've seen time and again that it is those folks that you often try to push to the side that are making sure that we win these elections, right? Black women are the reason that we keep winning these elections like this. Black women are the reason why Georgia is blue right now. There's nothing that you can tell me that will make me think otherwise. And that's not to say that other Black folks didn't help out, but I'm just going to say it strongly. Black women are doing it and have been doing it and have consistently done it. And the narrative that Black women are trying to save other people is tired and played out because it leans into this idea of Black women as mammies. We're not here to service and protect and serve y'all. We are voting in alignment with what's going to protect us the best and make sure that we have the things that we need and have the resources that we need to have access to. So going forward, I want people to, I guess, keep that same energy, right? While you're clapping for us, giving us all the accolades, everyone knows Stacey Abrams' name right now. Keep that up, right? Keep looking to Black women, keep trusting Black folks, keep looking to these queer communities in the South who have been fighting their asses off. I'm sorry about the language, y'all. It's the weekend. But keep looking to the people who have made sure that these things are happening, these changes are done. We have to remember that we have elders in our communities who have been struggling and fighting for years and years, right? We have to remember that we have young people in our communities who are brilliant and powerful and ready to do this work. We have to make sure that all of these people are listened to, that we're not discounting young people because of their age, that we're not ignoring older people because of their age, that we're not boxing out people of color when we finally make it into some of these spaces, that we're not upholding all of these systems that have not served us at all. Like Max said, divesting from these systems is integral to us making sure that we're holding them accountable. That level of accountability, that level of transparency that we're demanding, we have to make sure that we're maintaining it. And a friend of mine who was on the panel a couple of days ago said that, it's our responsibility that when we get into these spaces, that we continue to hold that door open, that we get up and leave if we see that they're closing the door in the face of our sisters, of our siblings, of our other people who we know are doing this work. So I say that for this next administration, I hope that Biden and Harris have their shoes laced up. I hope that they are ready to get running on these things that help put them in office. And I hope that the fact that all of those centrist Democrats lost and all of those extreme Democrats won helps people to realize and remember that we are only better when we're all better, right? It's not just about being able to meet someone in the middle or come across the aisle. It's about making sure that you hold these certain standards that you say that you're about.
Yes, yes, yes. I'm sick of that pandering, just every 4 years you care. It's no, I got stuff happening between election time that I can use your help with. Max, what are your hopes and dreams or fears of the future?
I'll start off with the fear. The fear is still around what we are dealing with. All the further mistrust, the further dilapidation of what the work has become, and also the worries extremely around also the international affairs that have also been trampled over the last administration, and also hearing from folks. A lot of already misinformation that has continued to happen across this country, and how in which how it impacts my people. My hopes for this administration are for them to finally see and do something around the constant problems around racial justice, not just in a public health setting, in the criminal justice setting, in the economic setting, and do multiple layers of work around that, or start to do multiple layers around that important work that has to be done. I want to make sure that my folks got access to healthcare, and we're not paying for what people when they need a test, and we understand, and because of what this country is going through right now, my hope is that we wise up and understand that there has to be something where the most impacted of us have to have the care that they need. And my third hope is that we get to that next horizon, that we're able to dream that we're closer to dreaming the thing that we really need. I don't need that from the administration per se. I need that from our collective, of the folks that are living on this earth, who are being impacted by these harmful policies and also harmful politics that we are seeing, that continue to divide us while understanding this is killing us. We have to come together in order to address that, to be able to continue to survive and live. So the three major pieces: addressing racial justice on the multitude of levels in which it is impacting us, making sure that all of our folks are having access to the care that they need, equitable healthcare that actually deals with the things that they need. And then lastly, are really being able to get us closer to that dreaming part of what we actually want to see in the future.
Thank you. Jeffrey, what are your hopes and dreams and fears for the future? You're muted, I can't hear you. Okay.
Yeah, I was having problems unmuting for some reason. My fear is what Biden Harris will find once they're actually in office. All of the damage that this current administration has done, and what that damage will mean, not only internationally, but what that damage will mean for this country and all of us who live here. My hope is that this administration works on a healthcare plan, as has been mentioned by both Aisha and Max, that the health plan that's for all people, and that everybody is going to have the health care that they need, and that the health care is not just generic, it's a one plan fits all kind of thing, because it doesn't, and because we all need something different. So hoping that healthcare will be one of the priorities, and that it's not a generic kind of healthcare plan. The other is that my hope is that the cabinet and the people that are put in position are people that looks like the people who, one, help get him there, help get them there, and the folks who are those who are the most folks in need, and those are most depressed, because we need, just like we need everybody around the table when we're doing stuff on a local level, we need those same kind of folks at the table when we're doing stuff on a federal level. So my hope is that he's going to do that. And and that people who act up and out there fighting and protesting and pushing and keeping people held to the fire continue to do that even throughout this administration. Because just because it's they're Democrats don't mean that they're going to always do what's right.
That is so true.
I'm just going to say that damn sight better than what we have, and I'm sorry for being so damn political, but but they're not perfect.
So true, so true. We have our work cut out for us. Doesn't matter who's in the White House. I know that Julie just mentioned just electing a new president won't change things unless there's work done by everyone, including the new administration. That is true. That is so true. Y'all, this was such a great conversation. These are the folks that I work alongside, all the time doing this work. These are the people who are fighting for y'all, asking the right questions in these rooms, holding people accountable as much as possible. So I wanted to be able to show you them because I feel like we're usually on the phone or it's not always like out there like that. So I'm just happy that we were able to have this conversation. I hope y'all enjoyed this conversation. I want to thank Aisha and Max and Jeffrey for sharing such great insight. Lee, I'm going to pass it to you. I guess we're going to wrap this up and head to our break.
Yeah, I think we did. We, as Christina mentioned at the start, did want to take this moment to take a group picture. Normally we'd be like getting on the stairs or huddling together in person. So group pictures look a little different in the era of Zoom. So as folks are comfortable, if you aren't interested in being in a picture, no stress. But appreciate if you are, jumping on Zoom, and I'll pass it to Matt to like facilitate this. And if folks would, I'm seeing a lot of thanks in the chat. If folks would like hold off about 60 seconds for posting in the chat, that way we'll make sure we don't have that like pop up on Matt's screen as he takes us.
Yep, we are good as far as chat is closed. We are full screen. I've turned off anybody who is not on camera. So if you want to be in the picture, go ahead and turn your camera on and we'll get going. I'll give you all just another few seconds. It looks like everybody who is a participant I have on my screen, which is great. I don't have two screens, so this is a once in a lifetime opportunity. Okay, so I'm gonna count to 3. So everybody smile big, and I'll do a screenshot, and then I will also do one on my phone so that we have multiple options. So here we go, 1, 2, 3. Okay, great, screenshot done. And we'll do one this way too. All right, 1, 2. Oh, I should probably like move my face so I can actually be seen, even though I don't need more pictures of myself. 1, 2, 3. Great. Awesome. Thanks, y'all.
Thank y'all.
So good to see so many of y'all. Thank y'all for having me. Really shout out Aisha. I saw you, Alicia Diggs, Dante, Wanda, Terry. So good to see y'all as well in Charlotte, in North Carolina. Much love. Love to all of y'all. Thank y'all.
Thanks so much, everybody.
Yes.
Thanks for coming, Max.
Oh, and Aisha and Jeffery, y'all did their
Thank
thing.
you.
Thank you.
It was a
Aisha
pleasure.
and Max enjoyed being on panel with you.
It was a pleasure. Thank you.
Appreciate you both.
And
Great
thank you,
job,
Christina, for
and-
bringing us together.
Thank you so very much.
Thank you,
Thank you.
Great job, MCAN. Great job.
Thank you.
Yeah.
Well, the day is not over. It's just the start. We have a break right now, so y'all can go to the bathroom, do what you need to do. We have some really interesting workshops this afternoon. We have one on Hep C in Western North Carolina. We have one on like G-spots and orgasms and things of that nature. And then later on, I know everyone got really excited about that. They're like, "Ooh, I gotta go." And then there's a session on harm reduction efforts, especially in COVID time, which is going to be a good conversation. And we'll have another conversation about race, gender, and bias, which will be really cool. And we have some folks, some great friends joining us for that. So today, everything is good. There's no bad options. So feel good and feel free to hop around and enjoy these sessions. But yeah, I'm gonna let you go. I feel like I'm eating into your break. But all right, bye y'all. See you soon.